Welcome to the Environmental Health and Safety Virtual Classroom. I'm your host, Derrick A. I'm an environmental consultant and industrial hygienist, and for 27 years I have been working on the recognition, evaluation, prevention, and control of hazards in the built environment. And in this session, we're going to be discussing Legionella. In this Legionella session, we're going to be answering some questions you may have. For example, what is Legionella? What are the health effects associated with Legionella? What are my regulatory obligations? What are some prevention strategies? What are some response tactics? And what are some resources that I can refer to in the future outside of this session? Legionella generally refers to a bacteria called Legionella pneumophila. And Legionella pneumophila is a bacteria that is common to all water sources, lakes, rivers, streams, pools, domestic water in your building. What are the health effects associated with Legionella? Legionellosis. Legionellosis refers to two disease presentations. One is less severe, Pontiac fever, causes flu-like symptoms, generally is self-resolving, and usually affects healthy adults. The second is Legionnaires Disease, which is a bacterial pneumonia that can be fatal. In fact, the death rate is 1 in 10. It affects immunocompromised individuals generally, such as the elderly, smokers, people with lung disease, diabetes, etc. How do you contract a legionellosis? Again, Legionnaires' disease or Pontiac fever. The way you contract this disease is you inhale a water droplet that contains viable or living bacteria, Legionella pneumophila, typically serogroup 1, but sometimes serogroups 2 through 14 or non-pneumophilous serogroups. Collectively, these bacteria are considered or called Legionella disease bacteria or LDB. So the inhalation of a water mist, a water droplet, into your lungs deposits those bacteria into your tissue where they're able to then replicate and cause an illness. Legionellosis is a serious matter in the built environment. There are approximately 7,500 cases of Legionnaires' disease reported in the U.S. as of 2017. However, because Legionnaires' disease is likely underdiagnosed, that number is underestimated. Most people go to the doctor with atypical pneumonia. That is the diagnosis. The physician doesn't go through the process of diagnosing them with Legionnaires' disease. And folks who get Pontiac fever, which again is the less virulent situation for healthy adults, may not go to the doctor at all. Because Legionella is in all water, you want to avoid water mist. Drinking water with Legionella in it is a very low risk unless you have a propensity for aspiration. So you want to avoid water mists. Well, let's talk about in your built environment, where are water mists generated? Number one, the shower. This is the number one source of exposure. Number two might be cooling towers, particularly in environments where people are leaving windows open or spending time next to cooling towers, like the smoking section. Heated spas, evaporative coolers, mister systems. These are all very common pathways for the generation of mist and then the potential for the inhalation of mist that may contain Legionella disease bacteria. There are also high-risk activity and population combinations that you need to consider. Healthcare settings such as hospital or senior living centers, institutions such as prisons or mental health facilities often have 24-hour occupancy, so there's no break in exposure for the residents. They often house immunocompromised occupants who are more susceptible to contracting Legionnaires' disease. These types of facilities also often have limited water use, which increases the propensity for there to be Legionella colonization in the water system. Legionella bacteria are common to all water. They are omnipresent. The way they get into your built environment is essentially from the city. The city delivers water to you, and city water generally contains chlorine. Chlorine is used to control bacteria, not just Legionella bacteria, but all bacteria. It is not to make your water sterile. When the water arrives to your building, it contains a certain amount of bacteria that is acceptable. Once it reaches your building, if you don't use that water and turn it over, that chlorine will dissipate or get used up, which will allow stagnation of that water and the growth of many types of microorganisms, including Legionella disease bacteria. So you want to take steps to reduce the bacteria in your facility. You want to take steps to prevent exposure to mists to your occupants. But how do you do that in a practical sense? Let's talk about it. An important first step in protecting your building occupants is to develop a water management plan. A water management plan for Legionellosis is a risk assessment. Most of these water management plans will follow very closely the ANSI/ASHRAE Standard 188, version 2015, titled Legionellosis, Risk Management for Building Water Systems. Water management plans help control Legionella disease bacteria to protect staff and residents. It keeps your facility in compliance. The Department of Health and Human Services Center for Medicare and Medicaid actually requires people who are funded by that group to have a water management plan in line with ASHRAE Standard 188. But generally speaking, even outside of CMS-funded facilities, it is best practice. A water management plan does a variety of things. First, it designates a team, which usually includes in-house and outside subject matter experts. It allows you to identify and inventory all of your water storage and distribution components, such as pipes and tanks. And also, it allows you to inventory your water treatment locations, such as water heaters, water filters, expansion tanks. It allows you to inventory your flow control points, shut-off valves, mixing valves, backflow preventers. And then, of course, it allows you to understand, identify, and inventory your distribution points, faucets, shower heads, water spigots, cooling towers, evaporative coolers, water fountains, and the like. A water management plan will assign set points for things you need to control, factors associated with your water that are important to maintaining a low Legionella bacteria count. Temperature, chlorine concentration, pH, flow rates, flow times. It will allow you to assign a maintenance schedule for flushing, for cleaning, and for replacement of water-related components. It will dictate accountability processes and a schedule. So you would like to have a method and a frequency for challenging your set points. It's one thing to say we want our water to be at 160 degrees in the water heater. It's an entirely different thing to verify that. And you should be verifying all of these set points. It will give you a method and frequency for your preventative maintenance activities. Preventative maintenance is one of the key factors in Legionella control. It will provide for testing or measurement. Sometimes you might want to test the chlorine level. Sometimes you might want to test the temperature. Other times you may want to test for Legionella disease bacteria concentrations in your water system. And a water management plan then would create a response plan for various outcomes. When you're complying, when you're out of compliance, when you're severely out of compliance. And there, of course, will be mechanisms built into your water management plan to evaluate and update the plan as your facility needs change. Ideally, your water management plan will prevent illness, prevent people from getting atypical pneumonia, Legionnaires disease, or Pontiac fever. But there's always a possibility that you may have someone report atypical pneumonia or Legionnaires disease, or more than one case of Legionnaires disease in your facility, which would be considered an outbreak. What might you expect at that point? The first thing you probably want to do is some level of education. Providing Legionella 101 to key personnel in the anticipation of questions. You're going to need some level of training for your management team and some level of training for your line level people. You're probably going to want to verify the city water supply, water quality. What's the chlorine level coming into your facility? What are the Legionella bacteria counts coming into your facility? Have you sought out and addressed all of your dead legs or de facto dead legs? A dead leg is a section of pipe that leads to nothing. Maybe at one point there was a water fountain at the facility and you decided you didn't want the water fountain any longer, so you took the water fountain off the wall. But there's still a pipe that goes from where the water fountain started back to the main line. And because there's no flow in that line, the chlorine, of course, will dissipate. And that makes the water stagnant and allows for the growth of a variety of bacteria, including Legionnaires bacteria. De facto dead legs are also a problem. What is a de facto dead leg? A de facto dead leg might be a sink that you don't use because you're a snowbird, or a sink that you don't use because you're an empty nester, or a sink that you don't use because you eat in the cafeteria and you have no reason to use the kitchenette. The water in that line from the sink back to the main line will have stagnation, and that can lead to colonization of Legionnaires disease bacteria in the plumbing system. One of the main things that you can do is flush your water system. Flushing of all your water supply and lines and your storage vessels, hot and cold, will, one, purge any suspended bacteria in the water. Two, it will bring in freshly chlorinated water from the city, and that will help prevent colonization in your building. Replacing water filters is another thing that can be done to reduce the potential for Legionella disease bacteria colonization. You may not know that you have a water filter behind a coffee machine or behind an ice maker. The water management plan should clearly identify all of these filters and develop an exchange calendar so that you know exactly when those filters were installed and when they should be replaced. Ice maker maintenance, for example, emptying of ice bins and disinfecting the ice makers, this should be on your water management plan. You should have a schedule for when this is to be completed and a process to verify that it indeed has been done. Controlling Legionella means controlling your water temperatures. The water temperature that Legionella likes are the same things that you and I like. Not too hot and not too cold. Approximately 68 degrees to 122 degrees Fahrenheit. You want to make sure that you're setting your water temperature on your hot water side hotter than 122 degrees. Ideally 140 to 160 degrees. But keep in mind that when you deliver water to occupants or deliver water to staff, you don't want to scald them. So you have to have your system arranged in such a way that you can heat the water in your water heater, but also step that temperature down for whatever desired delivery temperature your water management plan calls for. For vulnerable populations, anti-scalding is a regulated issue, and you don't want to expose residents, such as skilled nursing facilities, to temperatures above 120 degrees, depending upon your jurisdiction. There are specialty locations in most facilities that require even higher temperatures for sanitation. Examples might include clothes washing machines, which you would want to have at above 160 degrees for your linens to be disinfected. Kitchens have sanitizers for dishes and cookware. Generally speaking, those are going to be at or around 160 degrees. So it's important to know that temperatures in your facility are going to vary depending upon the use of the room and the population in that room, but your water management plan needs to clearly identify what are your set points, and then you need to have a way to verify those in some sort of repeated, ongoing fashion to make sure that you are hitting those targets. In addition to checking your temperatures, you want to consider checking your chlorine concentrations. Chlorine, again, is added to control bacteria in water. And so if you have chlorine in the water, you're good. If you don't have chlorine in the water, might not be as good. How do you know what the chlorine levels are? Well, you can't go to your local pool supply store and get chlorine strips, but you can buy ultra low and low chlorine test strips online and use those to determine what are the chlorine concentrations in your water. That will help you determine your flushing regimen. Do you need to bring in more water from the city, which will be chlorinated, or less water from the city? How much chlorine is in the city water? Well, shouldn't be any more than 4 parts per million, but generally speaking, it's between 0.5 part per million and 1 part per million. It's never going to be higher in your building. That's why it's important to continuously flush your water system. Just like your pool at home, you don't add chlorine once and forget about it. You must continually add chlorine to your pool, which is a little bit difficult to do if you're trying to add chlorine into your water lines at your facility. So you must remove the water that is used or stagnant and bring in fresh or chlorinated water. You can sample for Legionella disease bacteria in water. What are the advantages and disadvantages of doing this? Well, the advantage is you know if there's a Legionella disease bacteria in your water and you'll know the concentration. But it is likely that all water contains Legionella disease bacteria. Maybe just onesie-twosies, but you're going to find it in your building if you look. This is not about the prevention of Legionella disease bacteria. It is not about making your water sterile. It's about the control of what we know is in your water. Legionella disease bacteria is coming to your building. It's being delivered from the city. What you don't want is colonization of Legionella disease bacteria in your facility. And that's why you need to take these multi-pronged steps to control them. Generally, your water provider is going to be adding chlorine to the water system. However, sometimes you may need to supplement that chlorination by adding an on-site chlorine injection system or other disinfecting tool to supplement what's coming from the municipality or the water district. If there is an outbreak in your facility, you may add chlorine in what we call hyperchlorination. You may shock treat your plumbing system. Specific to healthcare facilities, it's important that you are reviewing your pneumonia cases and recommending that they be tested for the potential of Legionnaires' disease. And if you have someone who is diagnosed with Legionnaires' disease in a clinical setting, it would be important to look at your last 6 months records to see, is there a trend in atypical pneumonia? And moving forward, you would want to review those records and recommend that any future patients with pneumonia-like symptoms be tested for potential Legionnaires' disease. If you're a facility manager and you use some sort of software to tell you when to do your tasks, such as a TELS system, it would be important to have your Legionella checks, your water management plan, seamlessly integrated into that system so that you know when you should change filters, when you should check water temperatures, when you should check chlorine levels, when you should flush water heaters, etc. If you do not have an automated calendar for your preventative maintenance cues, you need to develop something, even if it's as simple as a written calendar on the wall, so that you know and are prompted when you're supposed to take tasks associated with your water management plan. So as an industrial hygienist, working with thousands of clients around the globe, I'm often asked the question, what's the one thing I can do to prevent Legionella in my facility? And I would generally respond by saying, the one thing you can do is to forget that there is one thing you can do. Water management is a program. You need to be hitting on multiple fronts to have a successful outcome. To control Legionella disease bacteria in your building, you need temperature management, chlorine management, flushing, filter change, etc. All those things together will serve to help protect your population. Your water management plan should provide safe water for all of your occupants. It's especially important if you house vulnerable populations, such as the immunocompromised or the aged. If someone in your facility is diagnosed with Legionnaires' disease, it doesn't guarantee they received that exposure at your facility. Again, Legionella pneumophila is in all water. It's in your home. It's at your place of worship, it's at your gym, and it's in your facility. So depending upon where that person had exposure to mist, they could have gotten exposure to Legionella disease bacteria anywhere. If they're a housed population that's 24/7, it makes sense to think that they probably got exposure in your facility. But keep in mind that Legionella is in all water, and a Legionnaires diagnosis is not specific to your facility in most cases. What are some things that might be done if you have a Legionella diagnosis in your building? Well, if you're following your water management plan, it should tell you very specifically what to do. But in some broad concepts, you would start flushing, you would start draining, you would start changing filters. You would disinfect ice makers, for example. You might remove or detach shower heads and replace them with point-of-use filters that can actually filter out Legionella bacteria. Because again, showers are the place where most people are exposed to mist. You might remove the aerators on your sink, clean and disinfect them, and replace them. There's many things that you can do. Each facility is very unique, and each situation is very unique. But you're going to have to deal with education of your staff, education of your occupants, all the action items you want to take to reduce that Legionella potential, And then you're going to have to do some sorts of monitoring or some sorts of measurement to make sure that you're in the parameters that you're looking to hit. Your water management team will probably consist of in-house individuals and outside subject matter experts. If there is a Legionella outbreak or a Legionella diagnosis in your facility, it may make sense to bring in subject matter experts to assist you down these paths to make the right choices. It takes time for a Legionella to colonize your plumbing system. So too, it takes time to reduce a colonization. If you wanted to clean something, you would agitate, wipe, brush the debris away. Legionella bacteria live in the biofilm that adheres to pipes. Cleaning the outside of a bottle is easy. Cleaning the inside of a pipe is difficult, especially when you can't reach it. When it comes to Legionella, what resources do you need to have at your disposal? You should definitely have a copy of the ASHRAE Standard 188, version 2015, Legionellosis Risk Management for Building Water Systems. You should have a copy of a current water management plan specific to your facility that outlines all the things that you need to do to control Legionella disease bacteria in your facility. In addition, you should have contracted, before any outbreaks, subject matter experts that you would need for both prevention and response, which would include an industrial hygienist or a plumber, for example. So we talked about what is Legionella. We talked about health effects, regulatory obligations, prevention, response strategies, some assessment strategies, and some resources. The bottom line is every building is unique, and you're going to have to develop a program that is specific to your built environment.